New polling showing that 66% of women 18 to 35 dealing with a lot of mental health issues. And then you've got another 32%. So almost the same number say they know something's going on. They just haven't gotten diagnosed. A lot of people, of course, say it's just too hard. Well, yeah, because the system's confusing. So we've got a really big part of the province of Ontario dealing with mental health issues, with a lot of people saying it's gotten worse since lockdowns. And then 72% saying, look, I would get help. I just can't get it. And mental health, I mean, not only do we have the worst system, I mean, we have great doctors, but the system is patchwork, right? We don't have a comprehensive mental health plan, system. And if you don't have a family doctor, it can be incredibly difficult to navigate. Even if you have a family doctor, it can be incredibly difficult to navigate. It's almost like you need a concierge. I would suggest they create that, but then I know that would be a boondoggle. But it is a difficult system to navigate. And if you're under duress or in mental, duress, you're not going to go through it. So there's a concern here of getting people help, because obviously we've got the numbers to back that up. Dr. D.B. Suhr is CEO of the Ontario Association of Social Workers, which commissioned this poll. Thanks for joining us.
Thanks for having me. Good morning.
You say the numbers are alarming. What alarms you? I mean, we've known the issues of mental health are on the rise for some time, but what is it alarming to you?
Well, we're worried. Certainly, we need to sit up and take notice, because the numbers tell us that women are impacted by mental health, especially young women. If you think about that age group of 18 to 35 living with a mental health condition, over 66%, in fact, of which, as you mentioned, 34% believe they might have an undiagnosed mental health concern, and just over 30 have a diagnosis. Well, we know this is an important age group. 18 to 34 coincides with a lot of life struggles and challenges and big decisions. And we want to sit up and take notice and make sure a young woman's life is taken care of.
Anybody at this point, it's not a stretch to say that a lot of people have been impacted, certainly by lockdown issues, and a lot of people are really struggling to get the help. And the one thing I do hear the most is it's so hard to get through the system. And so the question becomes, how are we going to get these people help? Because we'll get the political announcements, doctor. You know that, we're doing so much, we're making investments. But I haven't seen a good plan. And I think unless we've got doctors all of a sudden ready to go, and everyone's got that support system to say, okay, here, my doctor's going to be the central planner, and then I'm going to move into the system, it's very difficult. Now, you got to fix all these problems to actually be able to serve people and get them on the mental health side.
Well, it is a very complex system. You mentioned the patchwork and the confusing notions that we have to move through to get the help that we need. In fact, a large majority of our respondents told us that even if they thought about reaching out, they were frustrated by at least one barrier. And so this is an important age group. These are people making their first time life decisions about families and care. And what we really need is folks injected into the system like social workers and mental health professionals who can help to guide and support people, connectors, if you will, people who need the help and getting them connected in the places they need it most.
But there are still wait lists. And so the concern would be, what would you advise someone, let's say, who does not have a doctor and is in a bit of panic, knows something's going on and can't really get, can you walk into a walk-in clinic and get that kind of help? Because those I hear who have gone under, situations where they have anxiety or they need to take time off. One of the biggest things is that if they don't have a doctor, it is really, really hard to do almost anything.
Yeah, it's very hard if you don't have a family doctor. We know that getting help is not just as easy as picking up the phone and calling a mental health professional. That's why it's really important that those mental health professionals, like social workers that are essential to mental health care, are added to places where people are. That's not just doctors' offices. It includes schools where children and families and caregivers are, hospitals, long-term care, in the emergency department, in your shelters, in the crisis and community support. So we need to see the investments in more than one place, especially where people are each and every day.
Yeah, because if you don't have stability, it is very, very difficult to actually help people. In your study, in your polling, on the other side, because I know we focus here on women, and of course it is International Women's Day, were there indicators that also suggested with men?
Certainly, overall, about a quarter, just over a quarter of our respondents said their mental health has actually worsened over the last year. And so that's kind of scary for the entire population. And it tells us that people are living with this each day. They're sad, they're depressed, they're worried, they're anxious, and they're trying to navigate their families and take care of their loved ones, get back to work, dealing with lots of new things that have come out of the pandemic, like isolation, discrimination, even hate crimes. We know we've seen an increase in many, many stressors across the lifespan.
Yeah, lockdowns have costs, and we seem to be paying an awful lot of costs because this wasn't. It's not only the pandemic. We had a lot of mental health issues before the pandemic, and we've known, doctor, that the system is flawed, and it's not the frontline staff. It's that we don't have a system that's easy to navigate. It is, there's a lot of ways you have to work through it.
Yeah, we have a complex system. I know at least one or two family members in the last while that have reached out. I don't know about you, but they've been so frustrated. And so what we need is folks that are going to help what I call system navigators, as you're talking about.
Are those services available? Because I'm like, this has got to be a great business, a concierge service for people it sounds cute, but really, when you're in that situation, you want to be able to pick the phone. I don't know what to do. And it's like, we got you. You're good.
Yeah, there's 22,000 social workers across Ontario who got you. Yeah. They do this every day, mental health work. They don't just treat and assess and get people in the door, but they actually guide them through the system. Mm-hmm. But 22,000 sounds like a lot, and we're across Ontario in many settings, but we need more of them because we need the government to fund them permanently in the places that people go, especially when they talk about mental health for the first time.
Yeah, almost like we don't have a telehealth line for mental health, do we? I mean, I know
there's Connects Ontario. It's 24/7. It's a mental health directory of services for mental health and addictions. But you're right. If you're reaching out for the first time and you're in your doctor's office, or you're a child in school, or you're a young adult in that age group of 18 to 35, you're likely disclosing not necessarily for the first time that you need support in the most obvious places. That happens in our homes, in our communities, on the phone, virtually, and often in an unexpected situation. And so that's why that help needs to be readily available without wait lists, and that requires that permanent funding.
Yeah, absolutely. Kids with eating disorders, anyone with an eating disorder cannot wait 2 years for help. But these are the big challenges we have ahead. Doctor, very much appreciate you joining us today. Thank you.
Thanks so much for having me. Happy International Women's Day.
You as well. Thank you. That is Dr. Debbie Sur, who's with the Ontario Association of Social Workers, who did this poll. And we've known this is an issue. It is a much worse issue now. And we are a long way off from a solution.